find you among Telangana, all our past presidents and national secretaries.
Then was willing to come here on Sundays to serve the people at the specialty of nephrology. Madam, we are indebted to you, madam, for accepting our invitation and honoring us for the convocation of the annual conference IMA-AMS. Thank you very much, madam, the healthcare workers. Secretary to this convocation ceremony. We have with us learned team, Sarita, for all the work they have done to make this annual conference a great success.
Honorable Governor of Telangana, Dr. Srimati, Dr. Tamilsai Soundarajan, Madam, Namaste. Series of IMA, Dr. Rajan Sharma, you are trying to conduct regular programs and this type of training programs. And I am sure during this time of Corona, you will be concentrating more on updating the knowledge of all the doctors.
Hope everything goes well till evening. And madam, we are very fortunate to have you as a governor, medical, and the last 40 years, at least in our state, or most probably anywhere in India, hardly I have seen a doctor become governor. And we are all proud in Telangana, entire state medical profession, whether it be IMA or nursing homes or medical council, we are all proud of you. And we love to take your suggestions, guidance, and anything for medical fraternity. My only feeling is that during this pandemic, mortality of a general population is, whereas when it comes to healthcare workers like doctors, nurses, and paramedical, it is 15%.
Sahano bhunaktu, sahaviryam karavavahe, tejasvinav adhitamastu, which means let us study together, let us acquire knowledge together, strength together, and let us pass on this information and knowledge to others so that we all can become stronger together.
My happiness and delight that the Indian Medical Association AMS could invite the Governor, Her Excellency Tamilsai, 3 generations of leaders. I am so proud that we are able to take part in a meeting where she is our chief guest.
The moment COVID struck in the country, we were as an organization, we were the first ones to come out with guidelines, which the Honorable Prime Minister thought it fit to give me an opportunity to address him. And then the violence bill came. Shri Amit Shah ji was magnanimous enough to immediately listen to our white alert, and we had a long VC with him, and this historical ordinance was brought.
That it is very difficult for me to talk about her, although everybody knows that she is a gynecologist by profession. She has worked in service for some time, and then she has written 3-4 books, of which How to Win the Election is one of them. She is also a wife, a mother, and a care for all the people who are here in Telangana in this present pandemic. We did not imagine that a lady will be leading, a doctor that too will be leading as the first lady governor of Telangana. And in this pandemic where we are trying to see that people don't suffer much, but all said and done, nothing is in our hands. We are trying.
Honored to be with your presence here, and we look forward to your address. Thank you.
Good afternoon to each and everyone here, and I am very pleased to inaugurate this convocation of IMA Academy of Medical Specialties and this IMA meeting by virtual conference. His words, and it is my duty to support the medical fraternity during the COVID. So I did that. It's only my duty I did, and really I'm happy to get connected with this program. And my respects to Dr. Ashraf, Chairman of the IMA, as he said, he's from Tamil Nadu, and from my student days, I know him from my student days. And as he mentioned, my husband, Dr. Soundarajan, used to go and serve the people of Trichy every week Sundays. Because I was a student of Tanjavur Medical College, and he was the head of department at Tanjavur Medical College, some 50 kilometers from Trichy, where Dr. Ashraf was practicing. And really, my respects to you, sir, and my respects to Dr. Ashokan, Honorary Secretary, and my respects to Dr. E. Ravindra Reddy, Chairman, Telangana State Council, Medical Council, and my respects to Dr. K. Ramesh Reddy, and my respects to Dr. Vijayendra Reddy, and my respects to Dr. Yadav, and my respects to all the dignitaries who are all connected to this webinar. And really, I'm very happy that this program is conducted through webinar, and the convocation program, as it is said by the All India Chairman, that in spite of the COVID, you are not failed in your duty conducting these annual programs. And really, in this pandemic situation, first of all, I salute the medical professionals, the paramedicals, and the frontline warriors who sacrifice their life and who are all working from frontline to safeguard the human society so that we are all protected from COVID. And I should thank the IMA Telangana state for their support, and always they have given me suggestions during my webinar, and their suggestions are conveyed to the government, and through that people are benefited. So I thank the IMA, All India IMA, as well as the Telangana branch, so that your work during the COVID situation is just exemplary. I cannot express in words. And as it is said, more than approximately 400 doctors have sacrificed their life in treating the patients. So I pay homage to them. And as you all appreciated, the ordinance brought out by the central government to protect the doctors, and 7 years jail for the people who are all actually harassing the doctors, attacking the doctors. As it is said by Dr. Vijayendra Reddy, doctors are treating, but they are pelted with stones, and there are problems. So these all should be prevented, and we are not only facing the patients, but we are facing the patients' relatives who became very violent when something happens to the patient. So doctors selflessly do their service, and it should be respected. So I thank the central government for bringing the ordinance to protect the doctors. And really, as it is said, it is our duty to protect the doctor fraternity, and whatever the challenges faced by the doctors, they should be protected. So only when doctors got infected during the COVID situation, when they got admitted at NIMS, I personally went there, consoled them. So it is a very small gesture, so that it will be a supportive measure to the doctors who are all treating the COVID patients. And all over the world now understood the sacrifice of doctors. I always felt when I was practicing and when I was studying also, the doctor fraternity viewed in a different way. They are, for an example, I should say, we were in Tanjavur Medical College. I was a student at Tanjavur Medical College, and we were residing in a place, in a very prominent place at Tanjavur. One vendor used to come. The view of the people on doctors are different. We study for years together, and we treat the patients, but a common man thinks Doctors are only minting money. One vendor used to come. He used to come and tell 1 kg tomato, 15 rupees he used to tell. My servant used to tell, no, opposite house you gave only for 10 rupees. Then that vendor used to tell, no, here a doctor's house, let them give. So that is the mentality of the common man. The amount of service we are doing, they are not bothered about that. They are not respecting it. Just like that, a vendor says, just like this is a doctor's house, both are doctors. So for them it is 15 rupees, for the opposite house is 10 rupees. So the doctors are viewed in that way only. But the amount of sufferings and the amount of sacrifice as medical students, I should say, nowadays doctors' children are refused to take the medical professional. So they are telling, no, you are not coming for movie. You are not enjoying the life. You are always with the patient. So we don't want to be like that. So nowadays it is very difficult to force the children also to become doctors. Even though my children are doctors, but it is really very difficult because the outlook of the patients and others also, it is different. But COVID, it is really a very challenging situation for the doctors, and doctors morning to evening they are suffering. And nowadays only the people are telling when they wear PPE for their protection, they wear PPE for their protection, for the travel. Now they are telling for few hours or 1 or 2 hours we are unable to wear the PPE, but doctors are wearing for hours together. Not only wearing, they have to treat, they have to think, they have to convey, what all things they have to do. So this is remarkable, whatever may be the service all over the world. But I should congratulate the Indian doctors, as it is said. Really, the mortality rate less than the Germany because of the expertise management and protocol and the sincere commitment and service by the doctors. That I say. So only our Honorable Prime Minister said, mothers gave birth, but doctors gave rebirth to all of us. So he made the army to shower flowers on the doctors and the medical fraternity and the paramedical staff and others. But it's our duty, whatever may be the challenges we face, it is our duty to save the patients. But we have to, with the mentality of the patients also, we have to be, it is very much worrying. For example, once my husband was telling, one patient was on the way to see his doctor. That doctor died of COVID 3 days back. Then the family was so hesitant. The patient would have been so affectionate to the doctor. So how to tell? They were so hesitant. And they were telling that the doctor is no more and then he passed away 3 days back. The reaction of the patient was something surprising to the family. Okay, then we will look into for another doctor. Okay, we'll see another doctor. That's all. So it was very painful to hear such situations. But in spite of all this blow, in spite of all these mental challenges, strain, doctors are working. But now usually they say doctors are gods and next to God, these are the words they say, but really that respect which is rendered, it is highly questionable. But whatever may be the protocols and the dedication and the commitment rendered by the doctors, it's highly commendable. And I should say now the focus is on the field, that is blessing in disguise. So now the infrastructure should be improved. All the governments, all the state governments as well as the central government is taking the task to improve the infrastructure. And I should say the central government has increased 47% medical seats. Previously 65,000 doctors were coming out of their exams every year, and now it is made 1 lakh. Then it should be more. The government is at it. More than 75 new medical colleges have been announced. New aims has been announced. So the central government is taking the process, the introduction of the hospitals and the improvement of the medical infrastructure to its top priority. And I should say it also protects the doctors, and the medical insurance scheme brought out by our Honorable Prime Minister is helping the patients as well as helping the doctors. Sometimes as doctors we feel because of the economic background of the patient, we are unable to help the patients. But now that problem has been solved by our Honorable Prime Minister's Ayushman Bharat and the People's Pharmacy, which they renders medicine to the people in much economic cost. That also helps the patient. So doctors, we are serving the people, whether we are in the medical, private medical call setup or in the government medical setup, we are for the patients. And even though patients are not aware of our situation, understanding our situation, I always feel, because nobody thinks that doctors are also human. When I was a student at Tanjavur Medical College, the OP time is 7:30 to 12 o'clock. If a bank, if they go by 12 o'clock, if it is closed, they will come away. They will say, no, the bank won't open after 12 o'clock. But from 7 o'clock to 11:30, we will be sitting freely. Then nobody will come. But 11:30, they finish all their work. They finish their cooking. They finish all their work. They dress up. And by 11:45, they line up. Hundreds of patients will be there. And then they don't allow the doctors to get up, because doctor's time is 12 o'clock. No, you have to see us. So doctors are compelled in that situation also. So from the outpatient department to the surgery to the super specialty, we are all facing the challenges, but we are treating the patients with human mindset up, and so whatever the challenges, we are taking it. And I salute the doctor fraternity, particularly in this situation, and whatever the support which I am giving, which is a very smallest support, because I am very pleased that the doctor fraternity and the medical field is at it in the challenging situation of COVID. And as the head of the state of Telangana, I feel the first vaccine also should come from the state of Telangana and from Bharat, so that it should serve the humankind all over the world. And I really salute the doctors, and I am very thankful to each and everyone who got connected with this program. And I congratulate each and everyone for your exemplary service. Thank you so much.
Thank you. Been seeing some messages that they are really inspired and they are so very happy with your address. Madam, next part of the program is giving fellowship certificates. So we give fellowships. Asija, she is from Haryana in ophthalmology. She is also from Jammu and Kashmir, and she is in gynocs. Dr. Anil Mahajan from Jammu and Kashmir. He is from general medicine. Doctor,
best of my ability and to lessen the agony of suffering humanity, which is the ultimate goal.
Please, if you can admit them in the College of Fellowship, madam, if you can just put in a.
National Secretary said, please take up the cause of the medical fraternity in the face of the crisis of Corona. I'm sure with a good office, you'll be able to take up our problem with the National President Secretary has given you, madam. Thank you very much for your sparing your time being with us. We are so happy, madam. So much people have appreciated your speech. It was inspiring. Thank you very much, madam. God bless.
No issue.
So, sir, thank you for sparing your time, both of you, and being here at this convocation of AMS.